Hi, everyone. This is Dr. Kave, your Stanford and Harvard trained anesthesiologist and integrative medicine specialist, talking about that really controversial topic energy medicine and energy healing. Stirs up so much controversy. We just premiered a video where where I spoke specifically about how energy medicine might work, what we might know about it from the Western biomedical model. And there was understandably a lot of controversy that came up in the comments. So, by your request, I'm here to break down and answer your questions specifically about what energy medicine, uh, how it might actually integrate in a helpful way and not just scam patients with energy crystals vibrating energy throughout a room. To be very clear, nearly all forms of medicine from across the world have included energy as the basis of their medical model, even in the West. Remember that cellular energy is the foundation of all of cellular respiration, all that ATP that's generated in the mitochondria, we believe underlies every cellular process in our body. Hey, Linda, Sue, Andrea, Pamela, Heidi, Teresa, and Linda. I'm so happy that you guys came on so we can debunk this energy healing concept even more. The difference between the ATP that we talk about in the West and the prana or pneuma or chi is that we can't measure the other energy fields. Now, Michaela, good to see you on you here. And Chris, Michaela in particular had so many questions about consciousness and free will. So this is our forum to talk about it in a respectful manner, recognizing that we don't know the answers about energy medicine because we cannot measure the invisible healing field that it presumably fosters throughout our body. But I know that in patients before surgery who are suffering from anxiety, fear, PTSD, various phobias, etc., who are at risk of so many surgical complications after they wake up, if we can promote healthful behaviors that don't have appreciable side effects, don't cost anything, why not only entertain them, but also encourage them, or if the patient is interested, actually foster them? One of the best examples is the power of mindset before surgery, how this interacts with the energy field. I'd be happy to share with you all, but in short, we know that if we put headphones on patients who are under general anesthesia, yes, Linda, hypnosis is very similar here. If we put headphones on patients, even when they're presumably unconscious, they might wake up with less pain. I'm not going to argue with somebody who does not need more opioids, who is achieving adequate pain relief. We're not under treating pain. That is not right. But if they don't want more pain meds because they don't need them, and if that clinical hypnosis contributed through the mindset, which we believe interacts with that energy flow before surgery, at least from what traditional Chinese medicine suggests, I can't prove this. Why not encourage that if the patient is interested and brings it up? All right. So many questions. Iris, good to see you. Teresa, ask your question. Go ahead. Michaela, can you more specifically explain what you mean by energy in this context? Why this force is separate from the brain and neurologic process? Michaela, the question for you is, and really the question for everyone, does our consciousness arise from serotonin, dopamine, norepinephrine, glutamate running around in the brain? And that gives us our consciousness? That's what most people in the Western biomedical model believe. Or is consciousness something independent that interacts with our brain, perhaps mediated in part through neurotransmitters, like I said, but not a result of the neurotransmitters that I mentioned? So, if one believes in the consciousness that is entirely induced from neurotransmitters, well, that's a very different discussion. And that's why, like I said at the beginning, energy medicine, I don't believe should be universally applied. But if somebody is interested in it, perhaps we could harness that curiosity for a tangible clinical benefit. Christy Segan, good to see you. Teresa is saying, I was given midazolam before a procedure to calm me down, but instead it gave me a panic attack. Why does this happen? Teresa, we don't always know why we have panic attacks, these perverse effects to benzodiazepines, but in patients that want to have a sense of control, stripping them of that control while not stripping away their consciousness, puts them in a really uncomfortable position. So they want to know what's going on, but you just took away their ability to be with it. That induces anxiety. It can lead to potentially a panic attack, although it's very rare. Uh, Jessica says, I believe that energy and energy medicine is completely legit. I agree with everything that you said. Thank you. It's hopefully not controversial. It makes perfect sense. And I feel bad for those who are ignorant about it. Jessica, this is actually similar to what Linda Dove is getting at next. What about people who don't believe they can be hypnotized? So, the fascinating part about energy medicine and to an extent hypnosis is that the patient need not believe in hypnosis or believe in energy medicine to derive benefit. Isn't that incredible? From the anecdotes that I hear from practitioners that are far more into energy medicine than I am, there doesn't need to be buy-in. I mean, if I give you a pill, you may or may not believe that it's going to work. And I'll guarantee you, when I'm giving propofol, a lot of patients think they can fight me. They're not going to win. So just because they think they might be able to fight me and they don't think the medicine will work to help them go to sleep doesn't mean that that is not going to work. Energy medicine appears similar in many ways, in part perhaps because some of these acupuncture studies that show naloxone negates the effect of the pain relief suggest that, man, there really is a biochemical change when we manipulate parts of these energy fields, even if we don't know what they are as of yet. Great question. Hey, and by the way, if you're appreciating this coming on after a live premiere, could you please hit that like button and share what you've learned with others? It really helps support me. Thank you so much. You know that I don't like to do any ad placements. This is really for your education. And the more you can support me by following and sharing, the less I ever need to rely on those. Michaela says, we obviously can't rule out panpsychism. We don't know yet if it's emergent, but even if we granted consciousness as an intrinsic property of matter, what role does energy healing play? Our well, the traditional Chinese saying that I shared earlier was that the mindset or the mind or the intentionality guides the qi. The blood follows the qi, which suggests to me that if we're looking at mindset as being a driving force of our healing, if you believe in the panpsychism or not, it doesn't really matter to me because clinically, we know that the mindset shapes so much of a patient's course during surgery and after surgery. And at least in that TCM or traditional Chinese medicine model, gosh, if the blood as a metaphor for the physiology of the body follows that energy flow, which is directed by the mind and mindset and intentionality, is quite a strong connection that clinically I observe in the operating room and in recovery. Um, what is so Chris is saying, why are these topics not embraced out on the East Coast? There are probably many that do embrace them, but most doctors are afraid to talk about this because if we cannot measure something, we intrinsically feel this like, oh, I don't want to deal with it. To some extent, that's a very healthy habit because we want to make sure that we're objective and evidence based. However, there's a balance with humility. And if we pretended that things that we can't measure never existed, we wouldn't have discovered, I don't know, things like multiple sclerosis, for example, not being a functional neurologic disorder, but a white matter lesion that we just couldn't detect before the advent of the appropriate MRI sequences. Andrea, hey, says, thanks for empowering me before my monster spine surgery. I asked an anesthetist to talk to me through hard parts. I believe they did. Andrea, how was your recovery? I hope you're doing well. Linda says, I have 6 or 7 times tried hypnosis, never worked, but worked on my parents. I follow Cheryl. Well, clinical hypnosis, roughly, it looks like 50% of the patient is hypnotizable, meaning they're susceptible to suggestible states. 25% appear to not be well hypnotizable, and the other 25% appear to be very hypnotizable. In the operating room, I'm privileged to have medications like propofol that can help soften a lot of the cognitive rigidities that we intrinsically put up as barriers or obstacles to being able to take advantage of suggestible states. So it's almost like taking that 25% that's not clinically hypnotizable and maybe making that closer to 5% or 1%. I don't have an exact number for you, but that is the beauty of knowing how to use powerful medications with the right intentionality and compassion at the right time in the right patient. Uh, Chris, do you take heat from peers when I cover these topics? Yes, sometimes I do. Um, Michaela rightfully says the plural of anecdote isn't evidence. That's totally true, Michaela. Um, there is, however, nothing wrong in this mentioned chi. We can explain things without chi. Well, hopefully we will be able to one day. We just don't have a good model for it yet. If chi is an adequate synonym, I have no problem using that, recognizing that there isn't necessarily good proof for its existence or a way of measuring it. I will say that acupuncture does have demonstrable benefit for certain conditions that we don't have good treatments for, which suggests that there is something underlying it that might be based in some truth. Things like chemotherapy related side effects, xerostomia or dry mouth, chemotherapy related nausea, etc., as well as some forms of chronic pain. We don't really have a good hold on that yet. Some psychological conditions, depression, anxiety. But I don't know if there's anything intrinsically wrong with referencing chi, even if we don't know what it is, if there appears to be benefit without, once again, demonstrable risk, monetary risk included, or harm to the patient. But of course, a lot of this is emerging evidence, still anecdotal. But another thing, and Michaela, this is something that I think about a lot. Full transparency. When someone is in the operating room, there really is no other perfect comparator to that patient who's under anesthesia. Their past histories make them, of course, similar to other patients, but never exactly the same. And it's a struggle that all doctors have because we want to follow evidence, of course, whenever it's possible, recognizing the limitations to the individual at that time and place. Which is why, once again, it's a balance between, of course, anecdote is not strong evidence, but also recognizing that to some degree, at the end of the day, every patient is their own individual patient. It's something that we don't acknowledge much in the current evidence based medicine framework, which once again is very powerful and necessary in many situations, but can fall short if applied to the wrong patient at the wrong time, like any practicing model. What is light general anesthesia, Joe? That is a misnomer. There's no such thing as light general anesthesia. It's either monitored anesthesia care or general anesthesia. Um, Andrea, uh, wow. You did not have to go to the ICU. I'm so happy to hear that, Andrea, that you didn't need to go to the ICU and you didn't have as much blood loss as it seems like was anticipated. Michaela says, why can't we just say things feel nice? Of course, it feels good to have someone holding out a hand and telling us it's going to be okay. We don't need profound explanations for being human. Hey, I don't have anything wrong with that, Michaela. I like that. We don't need to dehumanize. We can just humanize. There's a tremendous benefit to that as well. And Linda, you said, are you a more open doctor? A lot of doctors are not as open-minded. If a doctor can't even answer tough questions that patients ask, you don't know if they will get it. Well, Linda, I think that the Western biomedical model is severely limited in answering some of the questions that matter most to our patients, like what will bring them joy or happiness or calmness, serenity? What will fulfill their purpose in life? Is this surgery, for example, going to fix the MRI findings of a radiculopathy, or is it going to actually bring you the fulfillment and joy that you want out of life? It's a serious question that we don't always get asked or volunteer to ask. And hey, Michaela, by the way, I appreciate what you're saying. We don't know, and that's absolutely okay. I agree with you 100%. Humility is key. And we'll end here with Chris saying, Doc, in my opinion, there's a clear disconnect between so many doctors and some of these less than standard procedures or topics. It's a real shame. You're right, Chris. Some of these less than standard procedures or topics are less than standard because there isn't a standard for them and they should not, there's not enough evidence to make them a standard. But that's where the potential for benefit versus the potential for risk needs to be weighed. This is the risk benefit discussion that all doctors should be having in their minds at all times. And like Michaela said, if we don't know, we need to be comfortable saying we don't know. Because realistically, there's more answers out there, or more questions than we're going to have answers to ever for something as complex as the human body, especially when we talk about consciousness. Um, Chrissy has had, yeah, interesting experiences under acupuncture. You're certainly not alone. Constance, good to see you. You come on at the end, but I hope that you can at least read the chats and learn from what others asked. Linda, thank you. Chris, thank you. Michaela, thank you for asking the hard questions. I hope everyone appreciates her not being shy to ask questions. Linda, Heidi, Andrea, and Teresa, good to see everyone on here. Remember, you all have more power over your health than you've probably ever been told. So keep curious and keep asking questions. Until next time.